Hello and welcome to Celiac.com news. Subscribe to our channel to get the latest celiac disease and gluten-free diet news. And if you have any questions, be sure to join the Celiac.com forum online at Celiac.com. And now, let's move on to the latest Celiac.com news. Study estimates the costs of delayed celiac disease diagnosis. Celiac disease is an immune condition in which eating gluten damages the small intestine. When diagnosis is delayed, people often spend years seeking care without answers. Their symptoms persist, and complications appear. These long delays have costs in both health and money. A recent nationwide survey in Iran set out to estimate those costs and identify which factors are linked to higher expenses. Between March and July 2024, researchers surveyed 375 adults with confirmed celiac disease. Participants reported when symptoms began, when they were finally diagnosed, and how often they saw doctors or specialists, underwent tests, or were hospitalized. Costs were calculated two ways: by multiplying each person's reported care use by official 2024 prices, and by totaling what participants said they actually paid, including medical bills, travel, and lost work time. The median participant was 30 years old, most were women, and just over half were single. People came from many provinces, especially Razavi Khorasan, Kerman, and Gilan. The median delay from first symptoms to diagnosis was about 10 years, an extraordinary gap that shows how long it can take to get answers. Before diagnosis, people visited general practitioners more than 7 times, and specialists nearly 5 times on average. 1 in 4 had been hospitalized for complications that developed while the disease was still undiagnosed. The average self-reported total cost per person was about 45.9 million Iranian toman, roughly 573 USD, while the modeled estimate using official prices reached 67.6 million toman, about 849 USD. Married participants, those with higher education, and people who were employed or self-employed faced higher median costs. Statistical analysis showed that being married and following a gluten-free diet longer were independently tied to higher total costs, likely reflecting years of accumulated medical expenses and the ongoing cost of gluten-free foods and follow-up care. Long diagnostic delays are common worldwide. Today, celiac symptoms often appear as anemia, fatigue, or bone problems, rather than classic diarrhea and weight loss, leading to years of inconclusive tests. In Iran, unequal access to endoscopy services, gaps in insurance coverage, and limited clinician awareness of atypical symptoms all add to the problem. The result is repeated visits, tests, and rising risk of complications. The findings point to practical solutions: screening high-risk groups such as relatives of patients and those with other autoimmune diseases, better training for primary care providers, and expanded access to affordable testing, endoscopy, and biopsy. Insurance coverage for diagnosis and follow-up, plus counseling on the gluten-free diet, could help ease the financial burden. Despite limitations such as reliance on participants' memory and the focus on one country, the study's large, diverse sample and dual cost methods strengthen its conclusions. The message is clear: early recognition saves money and prevents suffering. For anyone with persistent digestive problems, unexplained anemia, or a family history of celiac disease, early testing can spare years of uncertainty and expense. And for those already diagnosed, ongoing coverage for gluten-free living is an investment in long-term health. To get the latest celiac disease news and information, be sure to subscribe to Celiac.com news. Thank you for tuning in, and see you next time.